I'm here to provide useful information about root canal therapy. The first thing you should know is that root canals are done to treat broken, decayed, and sensitive teeth. Looking at YouTube videos, some patients and dentists alike post that root canals are a risk to your health and that any alternative treatment is a better option. The first truth, very few root canals are problematic. Full disclosure, I'm a dentist that provides alternative treatment. I've been labeled a holistic dentist. Additionally, I've had the experience of successfully providing thousands of root canal therapies for the benefit of lifelong dental health. As a practicing dentist, here I'll shine some light on the benefits and potential harm of root canal therapy. If root canal has been recommended for you, this information can help you decide on treatment options. By the way, root canal therapy is also called endodontic treatment. First, if a person has a badly damaged tooth, cracked down the vertical axis, or decayed beneath the gum line, that tooth just needs to be extracted. It shouldn't be root canaled. Hopeless teeth pose a real risk to one's general health. And when I say real risk, I don't mean localized pain and a missed workday. I'm talking hospitalizations, head and neck infections, brain abscesses. These happenings are rare, to be sure, but they're real, they're serious, and with good care can be avoided. I'm speaking to you this afternoon from my clinic, Roman Dental, in Houston, Texas. This is a city that's large, and because of that, most likely someone here is occupying a hospital bed with a dental infection. I don't want you to ever be one of those unfortunate folks. If you have a broken or infected tooth, in most cases it can be repaired. It's not super common for a tooth to get so bad that it can't be treated and saved by a dentist. Very simply, there are two options to healthfully treat a tooth with an internal infection. The choice is binary: either pull it out or attempt to save the tooth with root canal therapy. These are the things dentists check to see if root canal is needed. They'll check for pressure sensitivity when chewing force is delivered. They'll check for lingering sensation to cold air or ice-cold drinks. The same for warm foods and hot beverages. They also ask patients if they experience spontaneous pain, if the tooth wakes them from a sleep. If you have these symptoms, there's a strong possibility that endodontic treatment is needed. Root canal does relieve each of those symptoms. By far, the most common use of root canal treatment is to relieve pressure and temperature sensitivity. Sensitivity is a sign that a tooth's pulp tissue is inflamed. Dentists confirm tooth sensitivity by applying cold, heat, and pressure stimulation to the suspect tooth. Additionally, they'll gently tap on a tooth with a weighted instrument to help evaluate the health of a tooth's internal tissue, its pulp. These simple tests, along with an X-ray, are used to objectively determine if root canal treatment is necessary. Let me tell you what root canal therapy is, what it does, and then I'll tell you what can go wrong. Root canal is done to save teeth that are visibly decayed and have bacteria within the central portion of the tooth. That bacteria or infection needs to be eliminated. Root canal simply cleans away, disinfects bacteria within a tooth. That disinfection of the hollow area within the tooth is filled. This filling seals out future infection. It's that simple. If the pulp chamber is disinfected and well sealed, there's no place for the bacteria to live. This treatment prevents and relieves pain and swelling. The potential problem that root canal treatments present: in most cases, root canals will totally remove sensitivity, even in situations where the root canal fails to eliminate infection. This is the problem. The patient is left with a painless but infected tooth. Consequently, without being aware, a person can be left with a bacterial time bomb residing in the jaws, with the potential to cause life-threatening head and neck infections. The good news: this is rare, and with dental checkups, this issue can be identified and prevented. Why root canals don't always work out. Some root canals do fail. Here are the most common reasons. Teeth can have fractures that aren't visible to the naked eye. Teeth can have extra canals that go unrecognized and untreated. And some teeth have calcified canals that cannot be properly cleaned and sealed. Additionally, people that don't have good healing abilities, diabetics, those with immune disorders, they can have unsuccessful root canal treatments. So how can a failing root canal be recognized? Through X-ray follow-up. 6 months after endodontic treatment, dentists can visualize proper or incomplete healing. As seen in this 3D image, the darkness represents incomplete healing. The concern is that even though the tooth is completely free of sensitivity, the dark shadow may be teeming with bacteria which can infiltrate the bloodstream and cause unrecognized chronic inflammation, an unhealthy immune reaction. When a pain-free tooth fails to heal, even years after a root canal treatment was completed, it's often suggested that the tooth be extracted. This recommendation is made because infection is simply bad for one's health. Most root canals work out very well. Fortunately, a good diagnosis along with equipment and technology can deliver excellent lasting results. Surgical microscopes are used to find fractures before treatment is initiated. Three-dimensional X-rays can detect extra canals, calcifications, and most fractures. New dental handpiece technology delivers feedback control that makes endodontic care more rapid, more thorough, and more predictable. There are people critical of endodontics. They advocate for alternative care. The single alternative is to remove the tooth. This is not such a great option if you want to be a lifelong chewer and share a nice smile with your friends and coworkers. Teeth are delicate and complex articles of nature. Human intervention through dental care is imperfect. Therefore, limitations need to be considered. Still, peer-reviewed root canal studies show an 84 to 92% long-term success rate. With careful diagnosis, success rates can be even higher. Teeth deliver great pleasure throughout our lives. They allow us to smile, to laugh, to talk, to sing, and to eat. In my opinion, root canal is a safe, comfortable, and effective treatment.